All right, let's talk air fresheners for a little bit. Air fresheners. I compliment whoever it was who came up with that term, air freshener, because it has our brains thinking that we're freshening the air, doesn't it? Man, that industry has exploded. Just look at any retail store and the aisles full of plug-ins, wax melts, sprays, scented candles. They sell. But what's in them? Do you know what's in your air freshener? Chances are you don't, because anytime you see that word fragrance, it's a protected word. Proprietary information that does not need to be disclosed. So we really don't know what we are inhaling. I do know, and I can tell you just through experience, that those chemicals, they stick to us very often, or usually almost always. When I leave from a dentist appointment or chiropractic appointment, I change my clothes because I simply don't want those laundry chemicals in my clothes. And yes, they transfer from one patient to the bench to the next person. True story. That's how sticky these chemicals are. And why are we doing this to our indoor environment? But we don't do this intentionally to create health hazards. We don't. We just don't know, because advertising tells us it's a good thing. And guests and other patients and other friends and such tell us it's a good thing, because usually the only thing we hear when we use a fragrance product or air freshener or perfume or laundry product is, ooh, that smells good. We only hear the compliments, because it's very hard to tell somebody, ooh, your home is making me sick, I have to leave. We don't do that because, in general, we're taught to be considerate. And very often, we don't know that being considerate is not using any fragrance at all, because they're impacting a lot of people. We just don't realize it. Fragrance is a very personal thing, or so we think. The products we use, personal care products, are personal until they affect other people's spaces. Our world is full of different things, different toxins. Nothing's pure anymore. So we can say, oh, well, nothing we do is perfect. And that's a true story. But we can do better. We can do better if we knew that using some of these products was causing such indoor air pollution and causing so many people health issues. Maybe we could start reducing this a little bit or a lot. So I'm a child of the 60s. I was born in a cloud of cigarette smoke. Cigarettes were everywhere, and they were advertised as a good thing. They were relaxing. They were advertised by physicians. You could be in a hospital and see a doctor smoking. Unreal right now for us to even think about. To be on an airplane and people smoking. Can you imagine that? No, none of us can. To be in a restaurant. I know some states, I guess, still do allow smoking in certain areas of restaurants. But wow, it isn't like it was then. You don't, we know better, don't we? Because thankfully, the information and the truths came out about cigarette smoke and secondhand smoke. And now, everywhere we go, there are fragrance chemicals everywhere. And we don't think anything of it because it smells good to some of us, not to everybody. I used to think they smelled good until they impacted me neurologically and cognitively. I'm also a child who grew up with severe asthma. Fragrance chemicals don't impact my asthma. Thankfully, they impact me in other ways. But knowing what I know, Do I want to be inhaling them? Our lungs are precious. My lungs are precious. I respect them. And we have a lot of kids are living with asthma right now. I don't know, I think I saw a study where 1 in 10 kids in a classroom might have asthma. That's a lot. It's hard to watch somebody struggling to breathe. Our lungs are precious. Why are we adding toxic chemicals to the air? You know, most of us don't think of that. We don't think, oh, I'm going to spray this in a room, and we don't think of that. And that's why I'm making this video, because I just want to plant those seeds. We want clean air. If there's something in the air that smells bad, then it needs to be fixed. If it's a environmental thing going on, or pets, they don't need these chemicals either. And there's lots of studies that show the impact on their health. So invest in an air purifier. Clean the air, clean the air, clean the environment. But don't cover it up with toxic chemicals, please. There are a lot of teachers who use scent devices in their classrooms. This isn't done with the purpose to hurt anybody. No, they're used to create a pleasing environment, because that's what advertising has us believing, and because sometimes there are offensive odors and we want to figure out how to cover them up. But I am here to say that covering them up with chemicals that are not disclosed, because they don't have to be, but studies have shown that they contain phthalates, endocrine disruptors, respiratory irritants, skin irritants, lots of things that aren't healthy for us. So please realize that you can improve the environment simply by reducing fragrance products. And you're also protecting your budget. These things are costly. They're costly directly and indirectly, because down the road they are causing health consequences. So it's easy. Just don't use fragrance products. Reduce them one by one. Next time you need to replace a product, look for the fragrance-free version. It's not always easy, but it's worth the Where's Waldo hunt. So basically what it gets down to is the fact that less is more. Fewer fragrance chemicals equals more improved air quality. And isn't that a big deal? Air quality? Yes. Nod your head. Yes, it is. For those of us that lived through the 60s and 70s, we already grew up in a cloud of smoke, cigarette smoke. And we know what that impact has had on very, very many people. And laws have changed around that, thankfully. There are fragrance-free policies in various establishments, a growing number of establishments, and hopefully they get adhered to as this awareness becomes greater. But right now we can make that choice. Pay attention. Think about it. Do I really want to spray that chemical in the air that might be impacting my health or somebody else's? Choices. We all have them. Have a good day.